one of the things we have to tell our people back home is that no matter what the situation is, they need the hospital.
How does it feel like being somebody that works in the medical field, and then we all know the fear or the dangers with all society has associated to HIV. How does it feel when you are at your workplace one day and someone shows up and says, I want treatment in whatever he or she needs the treatment in, but the fact is he or she is HIV positive and you're going to have to work on the person? How do you feel like? What comes in mind? Working in the health sector, you are more at risk of taking a disease from someone innocently than getting it through the known route. Viewers, the person has given you the news, good or bad. Or maybe he didn't tell you, but you checked the records and you realize that, HIV positive. And it's actually part of the reason why he or she in the situation she's in that has brought her to you. How does it feel?
You see, one of the things of a health worker is the fact that you are going to be coming into contact with people with different conditions. Yeah. And now that's why you are a health worker. So yes, there are identifiers. For instance, in Ghana we're using folders. So for instance, if such a case is coming, already on the folder there is an identifier that gives you a head up that this case has this kind of infection that you need to be extra careful, or that there are procedures to follow. Okay. So as a health worker, your work is to be sure that you know what the work safety is, and then you protect yourself. It's only when you are able to protect yourself that you can be able to give your patients the best of treatment. So every individual who comes to you, it's one thing knowing the person is a patient. It's another thing seeing the patient or the person as a person, as an individual. So it means that whatever the person is presenting to you, it could be you.
That's right.
Yes. So you need to see everybody coming to you as someone who needs your help. And already people will come with all sorts of psychological issues, and it's not you to make them feel worse. Yours is to make them feel better. And it depends on how you handle and how you treat these patients.
That says a lot. Okay, so now you've worked as a physiotherapist. You've moved to the Volta region as a lecturer. You've taught for some time. You've had some experience in the classroom as an university lecturer.
Train a lot of physiotherapy assistants. Train a lot of physiotherapists. There are physiotherapists who have come through my clinic in internship clinical rotation period. Even in the clinic, you keep trying to train other colleagues who are coming after you. You try to guide, colleagues and assistants, those you are working with, and then you go on community outreaches to talk about what you are doing to the community and how they can stay safe and how they can benefit, how to people live healthy. So we've done a lot of things. And at each time you are doing something, you realize there is an interest that comes out, and you want to follow and then try to do more, chase that interest. So I believe it's through that process that I had to do my master's in the Kwame Nkrumah, the second university in Ghana.
No, that is not the second, right? That is not the second, right? KNUST is never the second university of Ghana. Please.
I like.
It's not the second. No.
I like this kind of debates.
You know, KNUST is not the second university in Ghana, honestly speaking.
So
maybe I need to get some guys here, and they will let you know.
Maybe one day we have to discuss this.
I think so. In that case, I will be very neutral, but then callers will just call in,
yes,
and
yes.
Everyone will make a point.
Yes.
The reason why you want to say,
and then at the end of it, we will see
which
one is first and which one is second. Anyways,
yeah.
when I say KNUST is the second, I mean that's my second university because my first degree was from the University of Ghana.
Now you are dodging it. Now you are dodging it.
From KNUST.
Yeah. Now you are talking. All right.
So then I had to do my master's in disability rehabilitation and development.
Okay.
And that actually like gave me a lot of insight into the different kinds of disability.
Yeah.
Until then, we are physiotherapists, so what we deal with is the physical challenge, physical impairment. But going into that program, realized that there are other forms of disability, and you come into contact with different, different people, and some are congenital, born with the condition.
Wow.
Others acquired it, through certain issues, and that has added to my practice and changed my practice.
Okay.
Totally. It changed my practice, and after that treatment, and then I started working with these surgeons who were doing breast cancer. We call it mastectomy.
Okay.
So they were removing, for instance, cancer of the breast. They will remove the breast. No, sometimes they remove the whole breast. Sometimes they remove the lymph.
Okay.
The lymph nodes, the affected lymph nodes in the breast, and most of these women will be left with, movement impairment in their shoulder.
All right.
And it's up to you, the physiotherapist, to get them back to full range of movement. So you have to go in there and help them to be able to get their full range of movement, use the hand again. And as I was involved in that, because that's cancer related, there are conditions where after even the axillary lymph node dissection, that's the removal of the affected lymph nodes, you realize that the lymphs start swelling. Some of them, after many years, they may come back. Others will go to the herbal homes, and then they will be coming back to the hospital maybe years after. And how do you then help them to reduce the swelling, to start using their hands again?
The situation is already messed up.
And I felt I needed that. That actually led me to my PhD, my PhD topic, and my research now.
Oh, okay.
Yes.
Wow.
So that was how I started looking out for where can I get enough knowledge, where can I get knowledge and evidence to be able to understand these conditions. And in Ghana, where cancer treatment is very expensive and it's not readily available, insurance does not pay for cancer treatment in Ghana, so there are only specific hospitals like Kolebu, Konfuanochi, and I think the Tamale, that they are actually doing cancer treatment, and it's expensive. So you can imagine if the basic person could not afford
treatment,
then what happens? Cancer is real, and people think cancer is not. It's not that real, but cancer is real. But the question is, if I'm unable to even go for the diagnosis, because I can't pay,
then how can I
treat it? And you can imagine the number of people who would rather seek alternative means of treatment because that may be cheaper.
Yeah.
There are places in Ghana where if you have a condition, you can just present a file and they will treat you. You don't need to give money.
And the treatment works.
It doesn't work, but then that's what we can afford.
Yeah, okay.
So the family could...
So that kind of put their minds to rest as if they are doing something about their situation.
Exactly.
But in actual sense,
majority
no
of
results.
Them does not work. But then they spend the time there, and at later stages they are reporting to the hospital, and little could be done. Little could be done. So one of the things we have to tell our people back home is that no matter what the situation is, the hospital should be the first point of contact.
Okay.
Just go to the hospital. Let them be able to tell you what the situation is before you go seeking other help.
Okay.
Don't go elsewhere. And when it's not working, because I keep asking my patients who come every time, I ask them, what happens if you go and you don't get the cure or you don't get the right treatment you are requiring? Where will you go? They say hospital.
Come back to the hospital.
Then I said, why then don't you go to the hospital first? And then, so one of the issues in Ghana is late presentations to the hospitals. Right. And that's an issue we would have to discuss maybe some other time.
God bless you so much and have a wonderful day. Thank you for joining us. But don't forget to subscribe to this channel. Write your comments under the comment section. Share this video to as many people as you can. Let us build a family which we can use to help each other. We want you to be a believer. In all this, we are talking about this as people who are living on earth, but we have heaven as our ultimate hope. So don't worry about anything. We are here to help you as a family. God bless you. Stay blessed. And remember, Koda TV is here to reconcile you and I back to the source. That is back to God. Stay blessed and have a wonderful day.
Koda TV, reconciling humanity to the source. Stay blessed.